So we're going to go ahead and start doing some fillers on Cassie. Today we're going to do Restylane and Perlane. And I like to use Restylane and Perlane above other fillers just because they're pure hyaluronic acid, and hyaluronic acid is a naturally occurring chemical in our bodies. So it has a very low reactivity rate, meaning unlike collagen that we used to use where up to 33% of people would react to and become allergic to, almost nobody is ever allergic to the hyaluronic acid products. I also like to use hyaluronic acid products. I'm going to go ahead here actually. I'm going to start doing her brows. We're going to give her a bit of a brow lift, so if you can get a good look of her brows here. Anyway, this is one of my favorite things to do because you get a really nice lateral brow lift without any surgery, and it's pretty instant. One of the other reasons why I like to use the hyaluronic acid products is if there's ever a problem, we can actually dissolve it. There's an enzyme called hyaluronidase, which we can inject into the area if there's ever a problem. The patient doesn't like the way it looks, or if they do happen to have a reaction, which I've never had a patient have a reaction to a hyaluronic acid product, then we can actually dissolve it if we need to. It's pretty cool. You can already see the difference between one brow and the other. Where, go ahead and open your eyes, Cassie. You can see it's got very much a lifted look to it on the lateral brow. Another thing I really like about the hyaluronic acid fillers is you can actually mold them to make them look exactly how you want them. And this is something that patients absolutely love because they walk in here and then they walk out of here looking 10 to 15 years younger. It's pretty much one of those things one of those instant things. So
That's awesome.
okay, so now I'm going to give Cassie the cheekbones she used to have when she was 15. As you age, this fat pad here kind of sinks down and contributes to the jowl and also contributes to the marionette lines. And if we volumize it just a little bit there, you actually see the marionette line decreases, the jowls decrease, and you look a lot younger. There's actually kind of a scientific formula for this. The most aesthetically pleasing curve to the face is called an OG curve. It's almost an S curve if you study the faces of movie stars and things like that. There's this perfect curve. And we make a triangle on the face and divide it by 1/3 right in the middle of the triangle, and that is the most aesthetically pleasing place to do it, and that's called the OG curve. So in her face, it's going to go right here. You can really make someone look funny if it's put in the wrong place. And I'm starting with Perlane here. Perlane is more viscous or thicker than Restylane is. We did Restylane in the brows and we're doing Perlane in the cheekbones. If you see that, you see the difference between here and here. I'm going to do a little bit more over here, but she doesn't need a whole lot. She has pretty full cheeks already. She just needs a tiny bit. So now I'm going to do these are called the nasolabial folds or marionette lines. And I'm going to put just a little bit of Perlane in first. I like to kind of put the Perlane in because it's more viscous or thicker on the bottom, and then layer the Restylane on top, just gives it a softer look here. And this tends to be a little more sensitive area for most people. But it really makes quite a difference in appearance as far as making you look a lot younger. Because it's not something, if you study the face of a 15-year-old, a 20-year-old, 25, 30, 35, as you age, this fold gets deeper and deeper. So we just filled the angle of her mouth there. It's about 1 centimeter. The wrinkle goes down about 1.5 centimeters over here and about 0.5 centimeter over there once we've got it filled. So I'm going to do the other side here now. So now I'm going to do her jowls here. If you see this depression there, we're going to make it so it's no longer depressed. And it's pretty amazing. It takes a couple years off your face just by filling that little spot right there. Okay, so now if you look at the line there, it's much less depressed. So now we're going to do her lips. There's actually a ratio of 1 to 1.6 that is the most aesthetically pleasing for lips and also other ratios on the human body that they found is the most aesthetically pleasing ratio. So her lips, if you look at them, they're pretty close to 1:1. So we're going to add a little bit of volume to her lower lip. And she also would like a little bit more accentuation around her upper lip line. So we're just going to do that and then add volume to the lower lip. So I'm going to start here actually just in the pad of your lip. And the lip is a more sensitive area than elsewhere. I'm going to go just barely inside of the vermilion border and inject it very gently, and you can watch it travel. Okay, so here we are done with her fillers. We did her brows. We actually did this line, the glabellar line, just with a tiny bit of Restylane, nasolabial folds, her cheekbones, the angle of her mouth, and her jowls, and then finally her lips. We did a total of 5 cc's, or 5 syringes of product in her face, and if you look at the before and after pictures, you can see quite a difference.